Okay, I think I'm live here. Hi everybody, anybody watching? Let me see if I can get Eugene to link I don't know, you're gonna have to deal with this glare today. It's just, there's nothing to be done for it. I've tried I angle my glasses down, but then I can't see it. I don't know. I'm having a day. I say that every time too. Like, no matter which way I turn, this makes me look like I'm going bald here. It's just the way my hair looks with the headband on. Yeah, and then the cat is like rampaging around the room. She's trying to like knock stuff over, and you're gonna see me eat because I'm eating this Pop-Tart. And there's glare on my glasses, so we'll just have to kind of deal with those things. Besides, I don't think there's anybody actually watching anyway, so it doesn't really matter. Actually, I'm going to reset. I'm gonna redo that. I'm gonna redo this, and I'm gonna end up taking this little bit down because I'm just not. I don't know. I want to link this to YouTube, but I'm not sure how to do it from where I'm at. Hi, it's nice to see you here. Well, I was gonna restart it and then delete that first part because I wasn't feeling good about it, but since somebody's already here, then I guess I won't. Alright, well, I might as well. Yeah, I didn't actually link that I was live in the Discords. I guess it doesn't really matter. I'm trying to get comfortable. Yeah, I'm here. And see, this is what I'm talking about. And I complain about this every stream. I get this glare. And so I try to like look away, look down. But then when I'm trying to look at the camera and look at the chat, there's no good. I even turn my brightness down on the computer. There's nothing to be done for it, and I look really washed out today. But it does auto adjusting, so I don't know. I need to figure out a better setup. Also, if I touch anything, one of my ports on my laptop, if you touch it, it will disconnect like completely. And so I don't want to deal with that. All right. What I should do moving forward is I should put like a timestamp in the description after we're done of when I actually start talking about the stuff versus just me sitting here messing around, taking off my socks. All right, so this is actually like not an unscheduled stream, but this isn't the normal stream day. But when I was reminded of this subject, I couldn't not talk about it right away. So today I'm going to talk about he's commonly referred to by the media, especially as Dr. Death. I don't like that. I don't like that saying. I don't like that term. It's just, I mean, I guess it's fitting. Even before, yeah, it is a fitting nickname, but I just don't like it. I don't like the negative connotations that come with it. Yeah, and if you hear me scratching, I have major bug bites on my legs. So you're going to hear me scratching. Like, I'm not like doing a DSP or anything under here. So, Dr. Jack Kevorkian. Dr. Death. Yeah, again, I hate that. I actually have notes today, like real notes that my computer's on top of. Okay, so I'm going to give you like a really brief synopsis before I kind of go into it deeper. Dr. Jack Kevorkian was a very, very strong proponent for like death with dignity, the right to die. He actually helped about 130 people. There's a lot of terminology that I don't care for when we talk about this stuff, just because of the power of words is so strong. The negative connotations that come along with a lot of these, like the term assisted suicide, really that's what it is. It really it is. It's the same thing. but I just don't like that term. It's just people balk at it. Um, and so that's I don't know. He helped a lot of people in their lives, and so there's a lot of details that go into whether or not he was in the wrong for doing so. There's a lot of, I don't know, legal issues, moral, ethical, and then there's also just Jack himself was a very strange guy. He was born on May 26, 1928. His parents were survivors of the Armenian genocide, and they told him a lot of stories when he was growing up about the death and destruction that they saw while all that was going on. Um, Jack grew up a very, very bright boy. He learned how to speak multiple languages. Hey, Lewis, you're actually the reason that we're here tonight because you were the one who said something about Dr. Kevorkian on the, I think it was in the Discord, and I was like, okay, well, yes, that's a thing. I didn't even consider. Then I cannot get comfortable, you guys. You're going to see me moving around a lot more than usual. And so, check out this shirt. This is one of my Dark Tower shirts. It has the, I'm not used to the camera. It's the gunslinger, and it has the, oh shit, I did it. I hit the mic off. Anyway, so he spoke multiple languages. Kind of reminds me of another guy that we talked about on here. The slightly more disturbing Deus, Anatoly Moskvin, also spoke a lot of languages. It's been stated that Kevorkian could, and I don't know if this is true, I only heard it from one source, but it's a source I trust. Yeah, and it's been said that he could write in one language with one hand and another language with the other hand simultaneously. So he was obviously ambidextrous. I don't know if that's really true or not. I could see it if maybe he practiced it, but yeah, this camera is terrible. I need to get more of a permanent setup with what's going on this time. I'm talking about, even though we're a little bit not unscheduled but shorter scheduled, talking about Dr. Jack Kevorkian. And his assistance that he provided to people. I don't like to use the term assisted suicide. I guess I probably will say it several times just for lack of a better term right off the top of my head, besides like a long drawn out, like assisted them in ending their lives is probably a better term that I like, but it's long. So Jack Kevorkian, when he was born in Michigan, and when he was younger, he went to medical school, and he got into some weird desired experimentations with, a lot of it was with deceased people or people who are getting ready to pass away. And some of these actually are disturbing even to me. Like, he would go to his patients in the hospital and he would tape open their eyelids when they're getting ready to die, and he would like photograph their eyes at the moment of death and before and after. And close the door, please. Thank you. And he wanted to see if you can tell how long a person had been deceased by looking at their eyes. And apparently this research actually was helpful, but I could not find out in what way without like a serious deep dive. I guess it really has helped doctors and forensics identify times of death. I don't know. I mean, I know that your pupils fix when you die. Like your pupils don't. Your pupils naturally contract and dilate, and when you're dead, that doesn't do that because it's a muscle. And that's one of the things that we check for when we're looking to see if someone's still alive, is if their pupils are fixed. And sometimes for about a minute afterwards, they can still go though. So that's not really real accurate if you're really close coming on them. Like if they're literally dying while you're there, like holding their hand, the eyeball thing it takes like a minute to settle down on that one. I guess that's kind of maybe details that people don't know about. The different body processes. Everything doesn't instantly cease. A lot of it does, but some of it doesn't. Um, I guess I'm going to go into this a little bit. There's this thing called agonal breathing. Now, agonal breathing is after your heart and like real respiration stop, your body will still try to take breaths. And it's more of like a hitching. It's not an effective breath, but it looks like you're still trying to breathe. And sometimes this can happen even minutes after someone has passed. Like, you'll be listening to their heart and trying to take their blood pressure, which it would be 0 if they're dead. And exactly how time of death was figured out, a lot of that stuff is more forensically done. Like, they can do part of it by the temperature of the body, by how much the blood has settled. Like, when people die and they're not circulating, your blood will go to the lowest point, and it liver temp. Yes. Oh, Rainy, you know what's up. Oh, right. Yeah. Okay. Yeah. So a lot of this is stuff that you already know. And also how much blood has settled. There's a term for that. It's called liver mortis. And then there's also rigor mortis, which is when your joints freeze. There's like chemicals like acetylcholine and things that when your muscles move, they use this chemical. Well, when it's like, I can't remember here. I'm getting on a digression. No brain activity. The heart is unreliable. Well, here's the thing though: is in most nursing facilities, nursing homes. We'll use the term that everybody's most familiar with. We don't have that stuff. You have me and a stethoscope and another nurse, and that's it. I mean, so yeah, it's pretty. There's several things you look for, like, so, like, technically, officially on paper, you're looking for uh, heart rate, respirations, blood pressure should all be 0. And then after, like I said, if you're real close, the eye might still contract a little bit, but then they won't act. Like, if you shine a light on the eye, then it won't move. But the real thing to me is and I don't, there's no real rhyme or reason for this. You can tell the difference. I'm sorry, I don't know what he's screaming about in there. The dog probably looked at him wrong. He's very sensitive to the dog. She picks on him. You can look at a person and just know. Like, you'll come around the corner and you're like, oh man, oh god, Mr. Jones, like, really? That sucks. But then you still have to do all the other stuff for technicalities. I mean, you could mistake somebody for being passed away and they really weren't, and that would be terrible. And I did, even though we're digressing here, I did have a lady, and this story messes me up to this day. I had a lady, the CNAs came running out of her room. She's dead, she's dead. And I'll call her, like, I don't know, Mabel, for the sake of the story. And it was not expected. There was no sickness or, I mean, well, obviously she was in a nursing home, so she wasn't at the pinnacle of health, but she wasn't, it was more of a cognition problem than a physical problem. So I go down there and I listen to her. I do all the stuff we're supposed to do. And I did look in her pupils and they were fixed. She had that look of a person who had passed away. And so I go up the hall and I'm like, oh man, to my coworker, I was like, oh man, will you come down and confirm? We have 2 nurses listen and confirm that the person is deceased. That's like a 2-person check, so you don't accidentally send somebody to the funeral home and they're still alive, which just happened here in my state, by the way. Like, time's funny for me. It was real recently. It was within the last year. They sent somebody to the morgue, and then she woke up and she's like, "Hey, what's up?" Anyway, so this other nurse comes in. She listens to the heart. And we're all standing there crying because we weren't expecting this person to pass away, and then that does happen. I mean, it happens, but it's when a person dies naturally over a period of time, they have the family and even us nurses, we have a time to process what's happening. And so it's not as emotional and shocking. So we're all crying, and and this is where it gets embarrassing because I go down the hall and I call the doctor and I say, hey, blah, blah, Miss Mabel passed away today. This time we have to call to get an order to release the body to the funeral home. So we have to basically just call up the doctor and say, hey, so-and-so just passed away. Can I have an order to release the body to the funeral home of choice? And they say, okay. And I say, okay, thanks. Bye. And then here comes the worst part of my job, 100%, is calling someone's family in the middle of the night to tell them that their mom has died suddenly. And I do this, and I always do this thing, like I take my glasses off and I start rubbing my face like this. And then I'm like talking on the phone like this. I got myself all bent over. I'm like, may I speak with Mrs. Jones, please? It's horrifying to do. And so I call the daughter and I tell the daughter, and she was upset. And rightly so. That's her mom. There was no warning of this. And so I'm like, do you want to come up and see her? Or, you don't have to. Some people come up and visit for a little bit before we go to the funeral home. And she said no. She said, you can call whenever you're ready. And I said, okay, well, thank you. And I'm sorry and all that stuff. So I hang up the phone and I go back down to the room. So this is literally I want to say 10 minutes later. I mean, enough time for me to make 2 phone calls and sit there and be like, oh, man. And so I go back down to the room and everybody's still in there. And we're just kind of talking about everything that happened. And all of a sudden, I look over and she's breathing. And I saw her start breathing again. It wasn't she was breathing the whole time, because she wasn't. I mean, this woman was deceased. 2 people confirmed it. The CNAs knew it before we did. And all of a sudden, she's back. And within 5 minutes, her vital, because first she was like, oh, what's going on? And her vitals were off. Her blood pressure was really low. And I don't know. But then within about 10 minutes, I'd say everything that was quote unquote normal for her was back to normal. And I'm like, what just happened here? And still to this day, I'm still convinced in my mind that woman was dead, and then she came back to life. And I actually asked a doctor about it, and she said she's heard of it happening. Maybe they were very, very close to death, but then and I know babies do this stuff and I'm not going to dive into the physiological aspects of that, but babies do that a lot. But I've never heard of an older person doing it. And she lived for another year. So that's kind of a crazy digression, but here we are. So back to Dr. Jack Kevorkian. He would do these weird experiments. He was fixated on death. And a lot of people aren't really sure, is it because of what he heard from his parents? Was he just born a little bit off? He wanted, so after he was done with this deceased eyes thing, he brought up that he wanted to see about experimenting on convicts. And this would be something that would be voluntary. So convicts that were getting lethally injected for their crimes, he wanted to see if they would volunteer their body to science, basically. And so when they would put them unconscious, sedate them. And then he wanted to do this. They didn't actually do this. Then they could basically vivisect them, or I never actually heard that word used, but that they could learn things from them that they might not be able to learn on a person who had already died, or that so it was there was again with the ethics. And anybody who didn't see my beginning part of this stream, I have bug bites on my ankle really bad, and so you'll see me like scratching. I'm not like like I said, I am not doing a DSP under here. But so that was a no-go. And then because of all of his, and I didn't write this stuff down, maybe I should have, because of his outlandish desires to do these experiments, he was actually kicked out of his residency program. And I don't remember the names of the colleges. I didn't write those down. But he did end up finding another one, obviously, because he did become a doctor. And another thing that he brought up is something that they did in Russia in the war, is they would infuse patients with blood from recently deceased persons. So instead of like drawing blood off of a live person and transfusing it into a, an injured person, they would find somebody who had just died. And the way they did this was in the wars, people wore things that had their blood type listed on it. So you could literally like grab somebody's dog tag and look at it and be like, okay, this guy's A positive. He's A positive. Hang on a second. I have to lean forward to read because Rainy Rider says, we called it soul seizing, where the soul is trying its hardest to reattach to the body, and the vitals go from borderline to A&O times 3 right before they drop. Well, I mean, with this person, like, she came back all the way and stayed back. I mean, she wasn't like, I don't know what the term is that, because, well, like you just said, soul seizing. Hang on, I gotta change position again. Don't mind my double jointed elbows. I don't know. I'd never. I mean, she was gone for a long time, and she had that look. And Rini, I know you know what look I'm talking about. It just stuck that time. It did. It did. But I don't know. When people pass away, they have a look, man. Like, I can't describe. If you've never seen a person that's deceased, and I'm not talking about in the nursing or in the funeral home with all that makeup and crap all over them, all dressed up with all that fake shit, like eye caps on. I mean, like a really real dead person. They have a look. I mean, like the second they're gone, you see it. Like you just know there's something that goes out of them. I don't know what it is. Yes, and the cat she's in a mood. She's rampaging around, trying to eat my Pop-Tart. So he was doing these experiments with deceased blood, and a lot of it was under the table. He didn't get like official sanction for it. But I know that he was practicing with injecting himself and some of his colleagues and even a couple of his friends, I think, with blood from cadavers. Not like long dead, because your blood does go bad relatively quickly. I heard the number. It's actually a few hours that you can use the blood. It just can't like congeal. Yeah. So he ended up contracting hepatitis C from all this like blood crap he was doing. Don't you love the technical terms? The blood crap. All the blood crap he's doing. Man, Rainy, that messes me up. Because I'm like, that was one of the most impactful moments of my career and oh God, and it gets even better because I had to call that lady's daughter back and the doctor. And I'm like, oh, doctor, like, oh God, you'll never believe what happened. Okay, well, she's back alive again. My bad. And then he was like, okay, whatever. The blood crap. That's a technical term. And so when I called the daughter, she's like, well, is she dead or not? And I'm like, she's here now. I mean, she's alive now. I said, do you want to come up and see her and make sure she's okay? And she's like, no, I'll take your word for it. But what happened? And I'm like, I honestly don't know. I was pretty. Oh, BT Dub, she's alive again. Yeah, pretty much. I mean, so, the daughter wasn't mad, and she probably thought that we were just mistaken, like, and we could have been, but I'd been a nurse for 18 years at that point, and the nurse that confirmed with me had been a nurse for about literally 30 years. I mean, she's 10 years older than I am. Damn. So I know I keep coming back to that, but I can't get over it. So the whole time that he's doing all these experiments and he caught hepatitis C, and he watches people suffer and die agonizing deaths, and he's thinking to himself, this isn't right. This isn't something that we have the medical knowledge that this shouldn't be a possibility. Like, we shouldn't have to let people suffer. We shouldn't have to take their feeding tubes away and withdraw their food and water, and I don't want to use the term starve them, but because a lot of the time when people are dying or getting closer to death, that's pretty much, Lewis, and I'm not even gonna lie, like, I think, because I have this professional voice that I can put on, like when I'm making these phone calls, I think I couldn't even maintain it at that point. I'm just like, yeah, well, hey, good deal though, right? Yay, she's not dead. I mean, so he was thinking about there has to be a better way to end people's suffering. And so he started working on, he started doing what he called a death consultation for patients. And that would be like counseling for dying patients. And a lot of them were like, doctor, help me. Please help me die. I can't live like this. It's too much pain. It's too much suffering. And he did. And that's something I've, again, personally heard more times than I can count, more people than I can count. They're, please help me die. They're like going in there, they're sitting next to me in their wheelchair, and I'm standing there at the med cart, and they're reaching up, they're grabbing my clothes, and they're like, help me die. And I'm like, I can't do this. That's not a thing. Okay? Like, I love you. I can't do anything for you in that way. He started working on a machine because he knew that the laws I guess I need to go into a little bit more in depth with that. The laws in Michigan at the time, obviously you can't kill a person, but there was no law against a person killing themselves. And that's where he got the loophole because there wasn't the term physician assisted suicide wasn't really a thing. Sorry, I cannot get comfortable, you guys. Like, so he made a machine, and he called it the Thanatron, and that's Greek for death machine. Like, Thano means death, and Tron like a machine. So the death machine, the Thanatron. He only ended up using the Thanatron on like 2 patients, I think. But the way it worked was there were 3 like containers. I actually have a picture of it. We're gonna try the screen sharing. The Thanatron, yeah. The death machine. I'm gonna try the screen sharing. Let's see if I can get it up here. Share screen. This piece of fucking crap. Alright, let's try this. Out of there. Where did the photo go? This stuff fucks me up. I was actually going to practice this today, and then I decided to sleep for a couple hours instead. Oh, here it is. For some reason, my computer put it way back in the corner, so that's stupid. Okay, StreamYard. With Thanatron. Yeah. Screenshot. Okay, present. Share screen. Wait, is this it? Oh, there it is. Okay. Ta-da! Again, these pictures are small. I'm not really computer savvy, which is kind of dumb when you're doing a stream, but I don't know how to like increase the resolution without, or like make it bigger without severely compromising the image quality. So you have here your Thanatron, and that's actually Dr. Kevorkian himself there. He looks pretty old in that picture. Looks like fucking Mr. Rogers. Like, got his sweater on. It's a beautiful day in the neighborhood. Come out to my van. And so the three things hanging here. The first one is, that's a bottle of saline solution that they would use to like prime the veins, to keep the veins open. And that's the same thing you get in your standard IV. That would be to like prep it and to give the medication, the other two medications, like a something to carry. He basically is piggybacking it, if anybody knows what that term is. So he's gonna let the other medication run into the saline as the saline's going into the vein. And then the second one was the barbiturate, and I can't remember what it was called. Oh, sodium thiopental. There was another name, sodium pentanol, I think was the other. There is a lot of that's just brand names, like, or they're very, very similar. Basically, what those are, it's a drug that people use mainly to, and I can't see if you're chatting. I'm still looking at the picture here. That people use when they're getting ready to go into surgery. So, like, it's used as a sedative to produce unconsciousness in a patient. And when they do, they don't usually use this, I don't think, anymore. I think now they just go straight to the gas. But I don't know. I don't work in a hospital. No, you're not here. Oh my god, sorry guys. All right, let me get off the screen sharing thing so I can see the chat here. We all learn eventually tubing is hard. Yeah, it is. It's always something I wanted to do though, and I think that the more I do it, and what I really need to do, and it's not that I'm just lazy, which I am. I'm not gonna lie. I have a lot of other stuff I always need to do, so I never get around to sitting around and actually like practice pulling up videos. And there was a video I wanted to show on here. Then I decided probably not a good idea because YouTube, even though it's available on YouTube, it's a video. Sodium pentothal, yeah, the truth serum. And I pronounce everything wrong. My mouth is bleh. I have mush mouth. But it's also used to sedate people prior to surgery. So that's the drug that would make people go unconscious. And then the third drug would be potassium chloride. Potassium chloride is still to this day used in lethal injections. Potassium chloride it's potassium. It's the same potassium that you get into our discords. We all compare methods. Okay, I haven't deep dived into that, but I look at the discords mainly when I'm at work, in between, like, while I'm waiting on the elevator or something. But so potassium chloride it's literally the same potassium you get from eating bananas, which really aren't that high in potassium, even though everybody thinks they are. But what happens with that is it's an electrolyte. Your heart and your cells need potassium and sodium, amongst other things, but those are like the two big ones, to make the cells fire, and that's how they keep your heart beating. And if there is a large influx of potassium versus sodium, your heart cells can't fire because of the massive disparity between the two chemicals, and so then your heart will just stop. So I guess that was kind of my quasi scientific breakdown bullshit. I do remember a lot of. I'm not trying to flip you off. I do remember quite a bit of it. It's just hard for me to articulate for like out loud these concepts. So what it is. And so the way he would set this machine up is he had it set up to where he would have to start the IV and have all the medications set up. But then the person could just, I think he had it set up to pull a chain. So the person, he would set it all up, and the person who wanted to die would pull the chain, and that would start like a chain reaction, I get, for lack of a better term, there was a pun there, where the saline would flow, and that I have a hard, well, to me it seems in my mind that it would have to be flowing already, like at least a little bit to keep the vein open, like a TKO, which is, I guess you'd only need it for like a minute, so you wouldn't really need a lot of time for this, so you don't really need to maintain that patency at 50 cc's an hour. Fucking nursing school bullshit. We don't do that shit in real life. Like, I don't. Like, we have an IV pump that does that for us. We don't dick around with it. And I lost it. The chain reaction. Okay, so the saline would flow first to carry these medications. Then next would be the medication that would make the person unconscious. So the person could stop this at any time. They could, pull the IV out, or they could say, Jack, stop it. And he could pull the IV out. He could clamp off the tubing. There's so many different ways that they could have stopped this. So they were alert and in control all the way up until the point where the sodium pentanol, god damn it, you know what I mean, until the sedating drug would take effect and they would be unconscious. So all the way up until there, they had complete control over the situation. One of the problems that he had, though, was he couldn't find some place that would let him do this. And so he tried all kinds of places. He tried to rent out, like an apartment. He tried to rent like a storage unit. He tried to rent, oh God, so many places, like rooms in hospitals, nursing homes, office space. He even tried to rent an ambulance, which they wouldn't. And everybody that found out that this is what he wanted this space for were like, hell to the no. Like, you're not going to come in here and kill people. Don't eat my Pop-Tart. I'm going to eat that when we're done. So he ended up, oh God, it's really sad. He ended up doing the procedure with his first patient in his van. This was in June of 1990. He met, I didn't write her age down. I want to say 53. That might not be right. Her name was Janet Adkins, and she had early onset Alzheimer's disease. And usually early onset Alzheimer's is rare, a lot rarer than regular Alzheimer's. It comes on quicker, harder, and people die faster from it. So general Alzheimer's, it can come on at varying speeds. Some people live a long time with it. Some people don't. Some people, it's a rapid progression, but the early stage Alzheimer's is usually more rapid. And at this point, she still knew, and because she was just she forgot how to read sheet music. She was a pianist, and she was forgetting things, but she had told her husband right from the get-go, like, I don't want to get to the point where I can't remember my family. That's the worst thing. I don't want to lay in a nursing home and choke to death on my food and shit myself. Like, she's like, I want to die my way. And she actually, one of the terms she actually used was, it's my life, it's my choice. And so she did not want to die from Alzheimer's disease, and I think most people would feel the same way. And because people are living longer now, and so many people have Alzheimer's, it's so common after the age of 80, that I think everybody that even people who aren't in the medical field, I think that they would know someone who currently has or passed away from Alzheimer's. Don't you dare! She wants that Pop-Tart. It's a strawberry Pop-Tart. It's not for you. It's pretty gross. And I use that term not like, well, there are gross aspects to it, but it's very painful to see people forgetting. And usually by the time they get to where they're staying where I work, they are quite a bit more progressed than. No. Okay, I gotta put this Pop-Tart up. She's gonna eat it. Let's see here. Uh-huh. Yeah, that's what I'm talking about. Now there's cat hair. Okay. It's so she knew what was coming though. And so she didn't want that. And so they reached out to Dr. Kevorkian for help. And he actually told her, "You're not the right person for this. You haven't, there are more experimental drugs." No, it's not even on a plate. It's sitting on my notebook. Like, it's not anywhere near where her food is. It's like, yeah, I didn't even put it on a plate. That's what kind of pig I am. I just stuck it on a notebook. But I mean, it's a Pop-Tart. They're dry. Oh my gosh, frozen. Wow, really frozen. Oh, he said, "You haven't done a lot of treatments. Like, give some of these other treatments a chance. There's an experimental drug that's coming out right now. I don't remember the name of it. Like, this isn't the right thing for you." So he didn't sorry, cat hair. He didn't instantly jump to, "All right, let's do it. Let's hook you up to the Stanotron and ship you out the door." And yeah, well, I can see how that would be a thing, Lewis. How, if that's like where she usually eats, she's probably like, "Okay, well, that's my plate and that's my spot." So, but so she did. She tried some of these other treatments that were suggested to her, and they didn't work, obviously. And then so she came back to him, and he said, "Okay, you basically did everything you could, and is this really what you want?" He would actually, excuse me, and you can find this one for sure. You can find online. I've seen this footage, the videotape that he made of his interview with her, and all the critics say, well, she couldn't make her own decision. Okay, at that point, after she had tried these experimental treatments, she probably couldn't make her own decision anymore. But that was a decision that she had made a long time before this video was filmed. She and her husband, even previous, before she got diagnosed, had talked about how if something happened, she wouldn't want to live like this, blah, blah, blah. So in the video, you can see he's like, "Are you from this place?" And she's like, "Yes." And he says, "Well, where is that?" And I think the correct answer he was looking for was like the United States or, the Northeast, whatever. But she couldn't answer. And he tried to get her to say the word death, but she wouldn't do that either. He's like, "What is it when you're not alive anymore?" And she's like, "You've passed on," or something. So she really struggled with answering the questions, but he did decide to help her. So he took her to a park in his van, and he'd actually sewed up some nice curtains around the inside of the van and like put a bunch of pillows and stuff in there. So he wanted it to be aesthetically comfortable versus like just laying on the back of a floorboard of a van. And he had like a bed put in there. She did not want her husband to see her die, so her husband went back to the hotel and waited for. Are you really going to try to jump up there? The cat acts like she's starving. She's not. Anyway, so he hooked her up to the machine, and he asked her multiple times. And there was another witness. It wasn't just those two. Jack's sister was there, and I believe another person. And he kept asking her, "Do you want me to stop? Do you want us? We can stop anytime." And she's, "No, I want to go. I want to go." And so he demonstrated how to use the machine. So he had an IV put in. He did botch it a little bit. It took 4 tries to get the IV in. No shit, she was probably dehydrated. I don't know. They nitpick the shit out of this, and I understand why. But some of the stuff has no relevancy. Like, okay, it took him 4 times to get an IV. Haven't you ever known a person that was a hard stick? I mean, maybe he's just not good at starting IVs. That's what nurses are for. Doctors don't do that. But I digress again. And so she did pull the proverbial trigger and passed away there in the van. And, Jack Kevorkian, he instantly got out of the van and called the police and said, hey, I have a patient here that is deceased. And so I'm going to make sure I covered all that. Okay. So he did get arrested. That's nurse work. Oh, come on, dude. I'm the nurse saying that. It's not like I'm a doctor being like, that's poo-poo work. That's nurse work. I'm a doctor. I'm not going to. Like, no, that's what you have nurses for. You don't need to do that stuff. And I'm not going to lie, I'm not good at venipuncture at all. But I could put a Foley in anybody on the planet. Okay. So he went to jail, and they tried to charge him with murder. And he's like, I know the law. That wasn't murder because I didn't. Even nurses have. Oh, dude, tell me about it. I know. I had that this morning. Everyone, not. I know it's not even on the topic, but like the veins were good. Foley. Yeah, Foley. I'll have to handle your dung. The tube that goes in to keep you from pissing all over yourself. Everybody who knows. Alright, so he's like, no way, I didn't kill her. She killed herself. I just set it up. And so he actually went to jail, went to trial. He had the same lawyer almost this entire time throughout the rest of his life, except for the last case. He had, basically, he'd been, okay, so he goes to jail, they do the trial. He's found not guilty of murder. And there really wasn't anything they could really stick him with. Besides some stuff like improper treatment of a body, and I think they just made him pay a fine or something. And so that's kind of a theme that will happen. Nurses or astronauts struggle getting astronauts. Oh, astronauts. I said assistants. I thought it said astronauts. Getting me put to sleep for some surgery. They went 4 or 5 times before the dentist himself stuck me on his first try. Whoa. Dang. Because usually the I guess doctors technically it's in their scope of practice to start IVs. I don't know how much they actually do it in real life. 0 where I work. I mean, we only see the doctor like once a week. But so they're definitely not doing hands-on shit. All right, so after I think it was his second trial for murder, basically, they said no more Thanatron. You can't use that anymore. That machine is done. Don't do it. So he decided to build something else. And this second machine that he used on most of his patients, I don't use the term victim. These are not victims. These are sick patients. These are patients that he was treating. Victim, regardless of... Victim is not a word that I'm going to use. I heard something about enema. As a CLS, I've had to go to an enema on a dehydrated patient if I couldn't get a stick after 4 limbs. We couldn't fish and couldn't hit the same limb twice. Well, you're not supposed to fish anyway, I mean. And where I work, you're allowed 2 tries. Each nurse is allowed 2 tries. I don't know about total number of tries, but, and a lot of nurses will do it more than twice. Let's be realistic here. They're like, oh, I can get it on the 5th fucking try. I'm a 2 and done person. I'm like, if I can't get it on the 2nd try, I'm not going to sit there and keep poking the person. That's fucked up. And, oh, Rainey, I got to talk to you because I never heard of that. I mean, obviously, if they're dehydrated, you give them no, I always get these backwards. Not isotonic. Does it like rehydrate them really quickly? Is it like the one that forces the fluid into the system and it rehydrate? Combat? Yeah. Yeah, that's crazy. I didn't know you could rehydrate people with enema, but it makes sense because you can take drugs rectally, like people who give themselves coffee enemas. Like, I mean, I heard about that. Wow, I learned something today. So the second machine he called a silver bullet. The large intestine sucks up water like a straw. Shit, I mean, well, knowing physiology, that when you pointed that out, I'm like, okay, yeah, that makes sense, but I just never heard that before. But what do you do if they're already fluid overloaded and you can't get a stick? Like, what if they're so full of edema you can't even see a fucking vein? Anyway, that's discussion for another day. Um, so he had his Mercitron. And the Mercitron was basically a mask, an oxygen tubing, and a tank of carbon dioxide. Or carbon monoxide. So, like, the same thing you get when you stick your tailpipe in your mouth, or, like, close up the garage. Except for this would be more of a pure, like a cleaner version of it. The ankler behind the knee. Oh, you talking, ooh. But, and then there's also osseous, intraosseous. I saw one of those once on a guy that I was coding, and the EMTs came and they gave an intraosseous to the guy, and I'd never seen one before. And when he was passed away, and we try to take all the medical stuff off of people when they're deceased, because it's not, the family doesn't want to see all that. They don't need to see all that. I could not get the damn thing out. I'm telling you, man. I almost stuck myself trying to get that fucker out of him. Anyway. So the carbon monoxide, I hear it's a very peaceful death. I don't know. Um, a seven lead for the chest, but no one wanted to use it. A 7 needle? Oh. Are you talking about like Pulp Fiction shit where like they give her that big ass injection? I mean, I know it's not like the same drug, but is that really a thing? I guess I don't know that much about emergency medicine because when you're in actual like nursing school is way different than like paramedic and EMT school. Like most nurses are not trauma nurses, and because there's so many different fields of nursing and medical, 7 gauge would be like this fucking big around, dude. Oh goddamn. Okay. In nursing school, there's so many different types of nursing. Like you have like hospital nurses who do like post-operative care. You have your surgical nurses. You have pediatric nurses. You have trauma nurses. You have school nurses, community nurses, hospice, long-term care. There's so many, like they cannot cover all of that in a class. Basically, you learn about disease processes and physiology and how most disease processes are treated, how to give medications, and then you basically learn the rest of that stuff on the job. Like you learn how to, and there's a lot of like certifications you can get that like specialize you in your area of nursing. Like there's, for what I do, there's like a gerontology certificate, which basically specializes you in taking care of old people, which is what I do. But I don't have that yet, but I'm gonna get it. Um, all right, again digressing. I'm all over the place, but at least I'm having a good time. I feel more natural today. Um, so the Mercitron, carbon monoxide poisoning. He says it's a pretty peaceful death. He set it up so that the patient could, if they physically could, take the mask off. They could do that. I mean, some of the people probably couldn't physically do it themselves, but he wasn't doing this alone, and other people would be there, and he would ask them like, "Do you wish to continue?" And they'd be like, yes." So that's that. So, but then we come to a point So after, and there's a lot more to this. This guy he was a spectacle. He came into court wearing all these weird costumes. He came in once like with his head and hands in a stockade. He came in dressed as a pilgrim. He came in with a wig, like all kinds of ridiculous shit. Because he wanted to stress, and I haven't really gone into his personality. I'm kind of saving that for the end. He wanted to stress how fucking ridiculous it was that they were wasting his time with all these fucking lawsuits. Or not lawsuits, like court proceedings. So he was acquitted of this 4 times. The civilians call it a fast. A fast. Yeah, I'm not even sure what that would even stand for. Yeah, I'll have to look into that. Because I do like learning about other aspects of nursing, even the nursing, not nursing. It's not fucking Bowser in here. I like learning about other things, even if it's something that I wouldn't be interested in doing, like pediatric oncology. Fuck that noise. Not even a little bit. So here we're coming on. So he's been helping all these people. He helped around 130 people. Thank you, Lewis. Thank you. Oh, I guess that wasn't Lewis. That was Rainey. Sorry. Usually I'm used to Lewis being the kind of, like military dude. Oh man, I lost it again. See, this is what happens, you guys. My brain, it's like ADD almost. I'm not diagnosed with that, but like I'll be okay. Here's my thoughts, and then I'll see something else, and I'm like, oh, squirrel, like, and then it's oh, but what was I doing before? What did I come in this room for? Fuck, and then I'll go back in the other room, and so I have so many thoughts. Like my brain is so full, it's hard to focus when there's so much shit going on in there. All right, so he helped about, and the numbers are very different depending on your resource. The most commonly used number is about 130 patients that he helped, and he would refer them to counseling, even though the court said that wasn't true. The families. Oh, and I didn't write this down either, but this is very important to me. In his court cases, the courts would contact these people's family members and have them come to court, and they would testify for the defense. So they would testify for Jack that he helped my family member, and they would be, upset and crying. He helped my family member. He is an angel. He's a hero. He's, you can't put him in jail. What he did, this was mercy, and on and on. So the family members were actually very much in support of him. And there's a lot of criticisms of details of things that he supposedly didn't do. They say that when they looked at the autopsies of a lot of these people, up to 60% of them did not have a terminal illness. And here's the thing. The term terminal illness, they say, they were ill, but they weren't terminally ill. For purposes of hospice, for an admission to hospice, you have to have a terminal illness with a prognosis of 6 months or less. So this person who had, let's say, MS, yeah, they might not have 6 months or left to live, but you can live with MS for years, all crunched up in a ball in a nursing home with a catheter in, infections, choking on your own spit. You can't swallow, you can't eat because you're all fucked up, your bowels are fucked up, you get a colostomy sometimes. MS is pretty hardcore, and it lasts a long time. It takes a long time to die from MS. And a lot of the time, the people can't talk, they talk like this. It's really horrible to watch. It really is. And then you have things like fucking ALS. ALS is the worst disease that I've ever seen. Worse than cancer, worse than fucking everything. I mean, I had some ALS patients in hospice, and these people literally couldn't swallow their own spit. And so they're drowning. And sometimes they would get like a suction machine that would help like suction some of that out. they're splitting hairs with definitions. The media was trying to vilify him. Oh yeah, they did. They did. And I guess there were some people calling him Dr. Death uh, before the assistances he gave to people, just because of his kind of fixation on the subject. But it was after he started his procedures that, oh yeah, yeah, I was like 15 when all this was going on, so I do remember it, but not, it wasn't something that I really cared about because I was like fucking, a teenager. I didn't care what was going on with that. Um, so he got acquitted every time from that. But then there came to a point where he, and he did this on purpose, knowing that he was going to go to jail. That was his intention. He's because what he wanted to do was influence the law to allow, uh, and I'm going to use the term physician-assisted suicide for lack of a better term at this moment. He wanted them to allow that to be a thing. Like, this should be, and there's many interviews of him out there ranting and raving about how, you want to watch your mom wither away, and that's inhumane, and what are you going to take their feeding tube out and starve them, and that's inhumane, and all this. Like, he really believed that he was doing the right thing. Like, he wanted to spare these patients from their suffering. So he had a patient by the name of Thomas Yoke. I may be saying that wrong, and I apologize if for some reason anybody is concerned about that. I'm not good with names. I can hear Tony laughing in there, so I'm like, what is he laughing at? His patient, Thomas Yoke, and I didn't write down what he had. I think he was an ALS patient, actually. He looked like an ALS patient who could physically not pull the proverbial trigger. He physically could do nothing. He just sat there. And even in the video, he could barely answer any questions that were, he was just sitting there like this. And Jack asked him several times, do you want to continue? And he says yes. And so this is where he kind of crosses that legal line. And he actively injects Thomas with the potassium chloride. Well, I mean, he put him to sleep first with the barbiturate, the sodium pentanol. Oh, I got it that time. And then he actively injected him with the potassium chloride, and that stopped his heart. So this went from being a passive setup that the patient actually does themselves, and this person didn't have that option. This pulling his own chain wasn't an option for this patient. And Kevorkian knew that this was the line that he was crossing, and he's going to go to jail, and he's going to be tried for murder. And that was what he wanted. And the patient was in on this. The patient knew about this and agreed with it. Because everybody's like, well, you just used that guy. And he's like, no, I treated this patient knowing that it was going to cause me to be arrested and charged. And he was aware of that fact too, and still wanted to continue. And so he did go to court, and here is a big mistake that Jack made. Jack was very full of himself, and again, I want to talk about his personality at the very end. He represented himself in court, and everybody knows the old saying, he who represents himself in court has a fool for a client. And they did convict him. They found him guilty of second-degree homicide, second-degree murder, and he was sentenced from 10 to 25 years in prison. And I might misquote this, but the judge said, you've been daring us to stop you. Consider yourself stopped. And at some points while he was in prison, he even said, if you ever let me out of prison, I will do this again. And that was like a moral conviction for him. But then they did end up releasing him from prison after 8 years. And this was more of a compassionate release, is what they call it. Bullshit release is what I call it. But he was elderly by this time, and he still had the hepatitis C. His liver was shot. Basically, they sent him home from prison to die because, and here's something that I've heard. I had a question. This is a long time ago. I had a question. Are there nursing homes in prisons? And somebody told me, they said no, because when a patient in a prison, a convict, gets to the point of needing nursing home care, they compassionately release them, which means they don't want to fucking take care of them and pay for their health care and their nursing care. They're like, well, bye. Like, we're gonna compassionately release you, so now you're free, but you're fucked, and now you're homeless and dead because we kicked you out and you have nothing because you're a criminal, and half your family fucking doesn't want to take care of you. You're just fucked. He had the hepatitis C all that time. That is correct. That's lifelong once you get it. There are cases of hepatitis C that do self-resolve, and they do have a cure for it now. But a lot of people don't even know they have it. This was way back in like the 70s. Maybe even earlier than that, the 60s, where he contracted this. So, yeah, he had it his whole life. And by this time, I mean, he's elderly. He's like fucking 70 something. Actually, I think he was 83 when he died. I think I wrote that down. Yeah, he did pass away. He died in 2011. Let me make sure that I have covered all my points on my little sheet here. I actually did. Oh, in 1991, he did lose his medical license. And that was another thing that they convicted him of, was practicing without a license, because the drugs that he needed to, especially for the Thanatron and the barbiturates, those were controlled substances. I don't know if they were then, but they certainly are now. We barely even use those, like, at all. So he did lose his medical license at one point. Let's see here. They released him from prison. He did not assist in any more deaths. I don't know if that's because he didn't want to go back to prison, or if he just never had the opportunity to. He was elderly and sick himself, and he did pass away. So that's kind of the story of Dr. Jack Kevorkian. So he was a strong supporter of, like, the Right to Die Act. Or I don't want to say the act. I don't like the right to die, death with dignity, all that stuff. And he was single-handedly the most influential in influencing our laws regarding these things, for better or for worse, because there were no real laws against assisting and back in those days, but then they made laws. So I think his attempts to influence this towards a thing that is happening ended up actually setting it back, because everyone was so outraged at what he had done. And anybody who's watching this would probably tell by now that I am a strong supporter of death with dignity. I think Kevorkian, his personal issues aside, and I'm getting to that still, the man was cocky and narcissistic, and maybe not a narcissist, but he had narcissistic tendencies for sure. He even admitted on an interview, on the 60-minute interview, that he is a zealot. He admits that straight out. So it's like he fixated on this thing, and because he thought it was right, he thought it was the right thing to do. I think, and I'm a supporter of it. If you've seen enough of what I've seen, if you've seen what I've seen, more likely than not, you would be too. I've seen what I would call easy deaths or good deaths. Those are I mean, the majority of deaths now are good deaths, but a lot, like with hospice stepping in, you have your medications that you're giving people. A patient's right to die as opposed to being kept alive under terrible conditions. Seeing that a lot of this is cultural. Oh, I was going to play my thing. Okay, one of my favorite podcasts did an episode on Jack Kevorkian, and the podcaster talked about hospice and comfort measures and things like that, and I wrote them a message. And this is a very popular podcast called Time Suck, and they have thousands of subscribers, and he read my message the very next week, and I almost crashed my fucking car because I heard my name. I was working hospice at the time, and I heard my name come out of his mouth, and I'm like, oh my god, that's my message, that's my message. And I had to pull over and listen to it like 3 or 4 times, about like misconceptions about hospice making people die faster, and which is not. They're dying anyway. All we're doing is giving them some relief from symptoms. Symptom management is the key. Like there are some symptoms that we do not treat. Oh my god, sorry about the kid. Oh, I want to grab a thing. Let's see if I can get up without knocking everything over. Because I want to show you something if I can get up. And don't mind my tore up chair either. My dog ate it.
I will not like you anymore.
Oh, he's not going to like it anymore. I saved a copy of this book from when I was working hospice. You see how like the camera itself tries to auto adjust to the lighting? Legally, yeah, there's a lot of bullshit. I don't know if you can't really see this. This is, we call it the Little Blue Book. It's called Gone From My Sight, The Dying Experience. This is basically like a owner's manual to your dying family member. That sounds cold and callous, and but it is not. It lays out what to expect when you have a family member that's getting ready to pass away, the natural progression of patients who are getting ready to die. And most patients follow most of this stuff in this book. It even talks about 6 months prior to, the person may start withdrawing socially. They may eat less, sleep more, those kinds of things. Somebody's in trouble. 1 to 3 months before the person passes away. That's a pretty awesome idea. With the owner's manual, like the Little Blue Book, that's what we call it. Because as a nurse, when we're sitting here on the day of admission to hospice in your home, let's say, we're piling and piling and piling information on you. This is what's normal. This is what's not normal. This is the legal aspect. Here, sign this paper, sign this paper, sign this paper. Do you understand this? Do you understand that? Do you agree to do this? Do you agree to do that? There's like literally 70 pages of legal bullshit that they got to sign for it. Like, and then we got to talk about, we have to talk about the specific disease process. We have to talk about medications. We have to talk about what we are and are not allowed to do under hospice. And a lot of that is kind of murky, and some of it that's not murky is sucky. Like, okay, well, you're a hospice patient, and a lot of people you can still go to the hospital if you are a hospice patient. Like, let's say you had cancer, but you fell and you hit your head. You can still go to the emergency room for an evaluation, but if they admit you, you have to do what we call revocation. Revocation means you are deciding to seek treatment that will prolong your life, and you have to give up your hospice option until the end of your period, which is like, each period is, I can't remember exactly, I think it's 3 months. 3 months sounds right. And so you won't be able to be readmitted to hospice until the end of that beneficiary period, is what we call it. So the person goes to the hospital, they get admitted for a skull fracture. Then they get discharged from that, and now Medicare says, well, you got to wait, 59 fucking more days before you can come back on hospice, and then you're fucked. So the legalities of it are pretty gross. Obviously, I don't speak this way to the patients and their families when I'm admitting them. That's not cool. But So we're piling all that information on top of people, and how much of that do they really remember when they finally gotten their family member admitted to hospice, which is a big decision in and of itself, because in our American culture, we are death deniers. We do not think that death is something that should be, we sweep it under the rug. That's poo-poo. Don't talk about death. That's bad. Like, we try to cover it up, prolong life. We have to do everything we can to keep people alive, whether that is in their best interest or not. And that's fucking selfish. Because if you're watching somebody suffer with pancreatic cancer or MS or goddamn anything that people are dying of as a disease process can be a very, very difficult situation, depending on their symptoms. And so the day you finally decide to give up, which I don't like that term, because even if you are accepting of hospice, doesn't mean you're giving up. It means that you are accepting that there is a disease process that will more likely than not kill your family member, and you are accepting symptom management. And the numbers are actually showing that hospice patients tend to live longer than patients without hospice, because there's that added care. Because they're offering more services, like you have a nurse managing them, managing their symptoms, encouraging, they have somebody who can step in and help bathe the person, and even the moral support, I think, is so important. Hospice patients actually tend to live longer than patients with the same diseases who don't accept hospice as a treatment option. And so I think that's something that should be discussed while healthy and coherent. I hate that they sweep it under the rug, so to speak. I am going to put Eugene on the spot. Death and dying is not something he wants to talk about. I understand that. I can accept that. It is a tough subject to talk about. But you have to, and we're not getting younger. I'm 41 fucking years old now, and I'm like, damn, I don't have a will. I don't have advanced directives. Well, I do, but they're so old. They're probably not even active anymore. I really need to update. That's actually on my to-do list, is to update my advanced directives. I need to spell out clearly what I want. And here's how, things like power of attorney work. Let's say I have a DNR order enacted while I am capable of making my own decisions. I have all the documented paperwork. Usually people who don't like talking about death don't know how to grieve. I've had a living, and then Rainey says, I've had a living will for 23 years. We've talked through every option. I have made my views on what I want very clear. I do not want to be artificially kept alive. That's a bummer for me. Yes, that's a no-go. Let's not do that. And it does depend on the options. Like, if they have to put me on a ventilator while they're doing some sort of procedure, that's different than well, we found you fucking brain dead in a car accident, and now we're just keeping you alive forever. So I think you can specify time frames for these things. Like, you can say, I'll try a feeding tube for a determinate amount of time. I'll try a feeding tube for, let's say, you can set time frames. You can say 2 months. And if the 2 months comes and goes and you're not improved, then according to your wishes, they could discontinue it. Advanced directives are actually more like something that you have as a guide for your family members. The person who is in charge of your health care when you are no longer able to make your own decisions is your power of attorney. Your power of attorney is someone that you select to make those decisions for you. But the best way to do it is to have advanced directives, which lays it all out. Do you want mechanical ventilation? Do you want CPR if your heart stops? Usually the way I word this when I'm speaking to patients at the nursing home is, we have our paperwork that says, yes, I'm a DNR, do not resuscitate. I say, like, this is a hard subject to talk about, but we have to talk about it. If we were to come in your room in the morning and find that you had passed away in the night, do you want us to try to revive you? And fucking 49 out of 50 times they're like, absolutely not. Like, if I'm dead, I'm dead, let me go. And I'm like, okay. And I just check the right box. And if they say, yeah, try to bring me back, I check that box. And that's that. But most people who are elderly have come to accept the dying, and that goes into like Erickson's 8 stages of development, and all that stuff. Like, as people age, they come to accept their own mortality more than younger people do. And oh damn, Rainey said he wrote his own obituary every time he deployed. I could see that. I used to want to like plan all my own shit, and now I'm like, I don't want any of that. Actually, the newspaper will make a death announcement. We don't need an obituary. That's a fucking waste of time. Funeral. That's a funeral. The funeral industry is a topic for another fucking day, because I do not have. I want to talk about this Kevorkian right to life thing. I don't have time to deep dive into my thoughts on the fucking funeral industry in America. I can't speak for other countries. It is a money-making racket. They don't care about you. They don't care about your family. I have seen funeral directors lie to family members, literally standing over their loved one's corpse, lie directly to their face about what the laws are in this state. And I looked them all up. So my thoughts are that I think death with dignity should be an option. I should get to the point here. I think it should be an option. Death can be a very, very hard thing. Most of the time with hospice, we are able to keep people comfortable. I say we, I'm not with hospice anymore, but I still take care of a lot of hospice patients, because you don't always go to a hospice house with hospice treatment. Hospice comes to you. And if your home is in a nursing home, you still stay at the nursing home, but the hospice nurse comes to you and kind of helps collaborate with the regular nursing staff. I got something on the screen here. Collaborate with the nursing staff there for your best option for symptom management. We don't, and this is very important. I want to point out for anybody who's watching that doesn't know this: if your family member is a hospice patient, and that was the point I was trying to make with the blue book. Dehydration is a normal part of the dying process. Your body knows what to do. It doesn't need all that liquid anymore. People want to encourage their loved ones to drink and eat, and if they're able to do so, that's fine. But yeah, Sean, that's actually pretty. Yeah, that's a thing, because here's what happens: is you're grieving, your mom just died. If you don't have your funeral pre-planned, prepaid, they come in and they're talking about what kind of casket you want to purchase. Like, and I'm not exaggerating, or I'm being literal. They're standing in the room, and there's the mom's body in the bed, and he's talking about, well, do you want to add this onto your services? Do you want to add that on? And I'm like, do you want to fucking get out of here with that? You want to not do this here? You want to give these people a fucking minute? I used to think hospice was a compound word. Hospice. That's cute. But hospice is we're here to treat symptoms. Sometimes, rarely, an IV might be an option for a treatment for a symptom, but usually it's not. Because here's what happens if you give a dying person an IV. It does not prolong their life. It doesn't hydrate them. That fluid, the body cannot absorb it the proper way. The kidneys aren't working the right way. The veins aren't working the right way. That fluid is just going to go in their veins and go to places it's not supposed to go to. Their veins might, what we call, infiltrate. The water will just go all over. It'll fill them up with fluid. It'll go to their lungs. It's just gross. But everybody asks for it. 9 out of 10 family members ask for an IV. Don't. It's not good. It doesn't do what you think it's going to do. It's not helping them. It's hurting them. Your body knows what to do. The dehydration is normal because you don't need all that food and fluid anymore. Like your body is slowly shutting itself down, or your loved one's body, I should say, or if you are the patient, and it doesn't need all that stuff. If you wake up or your loved one wakes up and they want to eat and drink and they can, thanks, Rainey. I know this is a long one compared. Yeah, this is way long compared to my usual. But this is something I'm very, very passionate about. So it was nice to have you, and I'll talk to you later, man. So I don't know. I knew that this conversation would happen. Like, I knew that I was going to digress a lot. My kid's screaming a lot. I knew that sometimes it's hard to tell if he's screaming because he's like pissed off at something, or if he's just like shrieking with glee at these weird videos that he's watching. That's when they knew they were going to pop. Before then, there were petitions to keep her. Say it ain't so, ho. Oh, Jesus. So that's I mean, and there's a lot more that goes into that. Like, people are scared of morphine. This isn't your great great grandfather's World War II morphine. This isn't like end of the line. They got a chopped off leg, so let's give them up some morphine. I mean, this is small doses. Helps. I have to say all this. It's like a disclaimer almost. The morphine is good when people are getting ready to pass away. They have difficulty breathing. Morphine reduces the body's need for oxygen and reduces the oxygen that is used. So that helps people to breathe a little bit better. That's the dyspnea, the difficulty breathing. And a lot of the time we use it in conjunction with lorazepam, which is basically like a Xanax, but not exactly the same. But those two combined, when you're physically more relaxed, you're using less oxygen. And so basically trying to reduce the difficulty, the labor in breathing, is one of our number one goals. Is pain. The three things we mainly want to treat is pain, dyspnea, and nausea and vomiting. A lot of people who are in the dying process have nausea and vomiting. Some of that is due to medication side effects. Some of it's due to natural physiological processes. All right, so that's I don't know. Yeah. Oh yeah. I have a fucking bottle of them sit chilling in a drawer. I don't like that stuff though. It makes me too tired. So Jack Kevorkian, and here's where I think that he fucked it all up. I have a theory about Jack, and I don't know. He, in my opinion, either had one of two things. I think he either had obsessive compulsive personality disorder, and I'm not a doctor, I can't diagnose, but this is a theory. Obsessive compulsive personality disorder is very similar to, shares a lot of traits with autism spectrum disorder, in a way that, except for a lot of it is fixated on control. People do obsess and fixate on certain things. It's one of those, like the diagnostic criteria, I'm trying to remember them all. One of them is being miserly with your money. He was very cheap. He would not, he wouldn't even pay for like new clothes. He got all of his clothes new. He lived in like little one room apartments. Even when he was a doctor, like, he was always very frugal. All he ate was French fries. And he lived to be like 83, so French fries, I think he just had good genetics with that. So, miserly with your money, strong moral convictions. And it's not necessarily the commonly held moral convictions, it's your moral convictions, and you will not break that for anything. Let's see, what's number 3? I'd have to look them up now, I don't remember all of them. Shit. I can't remember, I can't believe I can't remember them. But I think that, I feel like I could correlate a lot of, I have to look them up. Obsessive compulsive personality disorder. And it's kind of similar to autism in the fact that a lot of these people hyperfixate on a thing. You ever hear about autistic people having an autistic thing, their obsession? His obsession was death, whether it was alleviating the suffering of people who were dying or the experimentation with death. I think so. That's my theory. Is I think he might have had either obsessive compulsive personality disorder or autism. He was very socially inept. He dated a girl briefly, but other than that, he wasn't married. He didn't have any kids. He didn't have very many friends. He would rather sit in and practice writing in 2 different languages at once than go out and hang out with his buddies. OCPD diagnostic criteria. And you think I'd remember these? Oops. No, except cookies. See, and I didn't think I'd be getting into this part of it, so that's why I wanted to look up the... Oh, here it is. Characterized by a pervasive preoccupation with orderliness, perfectionism, and control with no room for flexibility that ultimately slows or interferes with completing a task. Let's see where talks about the criteria here, so I'm trying to find. Okay, so you have to have 4 or more of the following to be considered to have obsessive compulsive personality disorder. And I know about this. I was wrongly diagnosed with this. It was an incorrect diagnosis. It didn't really seem to fit me. I mean, it kind of did, but when I looked into it a little bit deeper, it didn't. So number 1, persistent pattern of preoccupation with order, perfectionism, and control of self, others, and situations. Jack had to be in perfect control of everything at every time. Yes, and there was another thing that happened to him when he was younger that I can't remember, but the Armenian genocide thing, his parents did talk a lot about what kind of atrocities they saw, and I'm sure that could have had a very strong effect on him as a person. And I know at some point his mother did pass away, and she struggled with a lot of these symptoms that are trying to be avoided with ending life. I mean, so it was kind of personal on that level too with him. Like he wanted to prevent that kind of suffering in others. So number 2. I lost it. Preoccupation with detail. Okay, so no, that was okay. So that was the overview. I guess I got that wrong. Number 1 is preoccupation with details, rules, schedules, and organization, and lists. Now, whether you're effective with these organizations and lists is neither here nor there, but the devil's in the details. The details are... You ever heard the saying, you can't see the forest for the trees? That's this. Striving to do something perfectly that interferes with completion of a task. And I see a lot of that in him too. Everything had to be so perfect. He would, even on that last day with Janet Atkins, he brought a pair of needle nose pliers and he kept adjusting and adjusting and adjusting the links. I see so much of that. Excessive devotion to work and productivity, not due to financial necessity, resulting in neglect of leisure activities and friends. That's a blatantly obvious one. This man was a workaholic. Even when he wasn't obsessing over his death stuff, he had a regular job. He was a pathologist. And then he was researching. He wrote some books on medical stuff. He did all this stuff. Oh, that's you? Well, we're only like, what, 4 in? So number 4, excessive conscientiousness, fastidiousness, and inability regarding ethical and moral issues and values. That was what I was saying, where you are very, very obsessed, like not obsessed with morals, but you have your own set of morals, and you are not going to compromise those for anyone. Like, you know what's right, they're wrong, end of story. That's it. Like, that's the bottom line. You know what's right, and you're gonna act that way. And then he was very, very adamant. And he was very, very bizarre socially. He was very kind of like quirky and just weird. He was a weird dude. And he was very passionate about it because he would say, they say something like, well, are you just obsessed with killing people? And he's like, absolutely not. I'm not killing people. I'm helping people live their life the way that they want to live it. And if that's wanting to die, then that's what we're doing. Like, he's like, I want to alleviate their suffering. I don't want to prolong it. Okay, so number 5, and I don't know how much of this was him. Unwillingness to throw out worn out or worthless objects, even those with no sentimental value. Hoarding. Basically hoarding. And from what I hear, he lived more minimally, so hoarding might not have been a problem, but so like every diagnostic criteria might not fit, but reluctance to delegate or work with other people unless those people agree to do things exactly as the person wants. So that's one of those wanting control. I hated doing anything unless I was 100% sure of the outcome. Me too. With the whole unable to delegate or work with others, that is very much. I do that to him. I'm one of those, if you want something done right, you fucking do it yourself, because other people won't live up to my standards, and that's a real crappy way to feel. Other people don't live up to my standards. Not in everything, I mean, but like, I don't know. I just don't. If I want something done, I'll do it myself, because I feel like if I don't do everything myself, then whatever I ask somebody else to do isn't going to get done, or I don't know. I struggle with that. A miserly approach to spending for themselves and others because they see money as something to be saved for future disasters. Now that one is partially me, because I am pretty cheap. I'm like, I'm not gonna, possibility it might not be done to your expectations. Fucking exactly. Especially like with my work stuff, it's very important to me that if I ask somebody to get a set of vitals on somebody, that they fucking do it right now, because I'm not asking for fun. I'm asking for a reason. And if they either A, make them up, which I have seen before, that they didn't even really take them, or they wait and wait and wait to the end of the shift, that's not fucking helping. But, so I'm weird about spending money on myself, even though I do. I'm like always trying to find a good deal. But like, I will fucking literally give a homeless person like $20 on the street, just with no thought about it. So I'm miserly toward myself, but not so much to others. Rigidity and stubbornness. So even though I relate a lot of these things to myself, the point that I'm getting with that is that I see so much of these symptoms just in the way that Jack operated, and the way he was so fixated in perfectionism and everything. But then a lot of these symptoms also overlap with autism spectrum disorder, except for the social interaction part of it. A lot of people don't like someone with OCPD because they are so picky. Either of those would infuriate me, especially fudging things. Just admit you didn't get it. Don't fucking make it up. Like, and you can see how passionate I am about that. These are people's, vital sign. Like, that's just an example, but if you really couldn't get to it, just fucking tell me, like, oh man, I didn't get around to doing that. I'll be like, oh shit, okay. But if you write down some bullshit and I find out about it, I'm fucking livid. I don't like being lied to. I'm very honest. And it's almost to a pathological level. Like, I have a really hard time with lying, even to spare people's feelings. So my whole point with all of that psychological crap, if you look at Jack Kevorkian And just the way he acts, his mannerisms, his fixations, his social skills, his preoccupation, his intelligence. I think he's on the spectrum. And I may be biased to thinking that because of things that I'm thinking in regards to myself, but he has a lot of social inadequacies. He fixates on one subject to the point of fanaticism. I don't want to say zealotry. We'll say that. He had his strong moral convictions. He just his quirky personality. His only wanting to eat one thing. That's a huge like sign of he loses control in stressful situations as far as like noises. So everything that I'm seeing, and just in the last couple of days I realized this because I have been watching a lot of interviews with him, which I'd never done before. I'd always like just heard about him third hand, like second hand. Thank you, Lewis. But again, I'm not a doctor. That's why I wish Dr. Amir was here. Maybe I should go and get some sort of psych degree. I study this stuff enough, it wouldn't be that hard. I mean, for me, like because it's a subject that I have taken classes on and I have studied and I'm very interested in. I think it would be like I said, I've taken probably 8 psych classes, like whether it's about the meds or the abnormal development 101, blah blah blah. It's so fascinating to me, the different psychological aspects of what goes into human behavior. What makes people act the way they do? I don't know if that's just because I constantly self-reflect on these things. Why do I do the things that I do? Why do I think the things I think and say the things I say? It's kind of a dangerous thing being on the internet because I know that I'm going to say things that are fucking stupid. I have no filter on my mouth. When I think of something, I say it. I can't control it to an extent. Like if I'm at work, I'm not gonna be like, well, you know what I mean. Like I can almost keep a lid on it. It's more, I don't know. I'm socially awkward to the max. People who know me, they like I'm weird. I'm the weird person. People either like me or they don't. Sometimes they don't. I'm brutally honest. Some people can appreciate that, like especially as a nurse. And I have heard this time and again throughout my career, is you're the only person that tells us the truth. You're the only person that doesn't sugarcoat everything. I don't just tell people what they want to hear, even if it's hard to hear. And I think that everybody should have the right to die with dignity, extremely guarded, and have layers upon layers of filters. I used to be that way a little bit, but I used to just basically not talk to people at all. And then I I still consider myself to be, I'm like an introverted extrovert because I like talking to people. I like being social with people, but I don't want to fucking go anywhere to do it. I want to do it from my house. Like I don't want to go places where it's noisy and loud and I'm uncomfortable. Like I get overstimulated. I have to be like physically comfortable. I can't regulate my temperature. I just get awkward. I don't know. So like I want to be social, but I don't want to fucking go places to do it. And I like to talk to people who understand me on some level, even if it's just that they understand that I'm a weirdo. It's okay. So, Lewis, you have no idea how hard it is to determine within yourself. I think the kid got in trouble. He's out there carrying on about something. What part of yourself is this fake persona that you put on because it's socially accepted to act a certain way? There's a lot of stuff that I do try to stop myself from saying. I like adapting to others and listening to them and getting lost in their story. I do too, But the thing is that I use myself as a reference point to help me understand things that people are going through. I relate it to myself. I relate in order to make myself understand and empathize with what other people are going through. I relate it to myself. And so it almost seems superficially like I'm turning everything back and making it about me, but that's how I understand others, is by relating to something that I have experienced. And so I think a lot of, yay! Yeah, she was trying to eat that Pop Tart, man. Okay, I'll never bring food in here again. I was going to eat it while we were live, and then I decided I can't talk and eat at the same time. Yeah, she was trying to get that Pop Tart. So it's really hard to know how much of who I am is this persona that society expects, like, to act a certain way, and how much of it is really who I am. But I also have a hard time filtering what's appropriate and what's not appropriate. What I consider just to be factual information, other people might consider to be oversharing. And I am 100% guilty of oversharing. If you're laughing at me, you can go fuck yourself, bud. I don't think he was, actually. So I don't know. As a nurse, the right to die and death with dignity are very, very strong. I have feelings about it. I think it's something that people should be given the right to. And honestly, it's not like in the state of Oregon, people are like, or let's use the Netherlands for an example. People say if people are given the right to kill, if physicians are killing people and helping them kill themselves, where does it end? We'll end up having death panels, and the fucking guy always going on about the goddamn death panels. There's no fucking death panels. They're not killing people. In America, we might do this. They're not killing people for financial gain, but I can see that being a thing here because it's all about the money. And then, they say they would pressure people into it. That's not what happens. There's psychological testing you have to do. There's physical testing you have to do. Yeah, now she's trying to knock the curtain off the window. And most patients, even that look into it, most of them don't do it. And even like Kevorkian turned down 4 out of every 5 patients that came to him for help. He got dozens and dozens and dozens of phone calls and letters. And actually, he wrote a book in prison. I have it coming in the mail. But I think they're wrong. I think they're wrong about that. And because that didn't happen over in the Netherlands when they legalized physician-assisted suicide. It's not. Anything can be abused. And in one of his interviews, Kevorkian actually says that. He states that. Everything can be abused. You can abuse any sort of power that you have over a person could be abused. I think my husband is outside fighting with somebody on the phone because he's standing outside the window of where I'm sitting. Like, I think he's preoccupied with some other trolling crap. We're living better and longer than ever, which is why I think those end of life discussions are so important. That's true because a lot of the treatments that we have for a lot of diseases will keep us alive longer, and the longer that, and I don't mean cures, I mean treatments. The longer that we stay alive with certain diseases, the more significant your symptoms are going to be. Yeah, Sean, he is. And I understand he can't involve himself with a lot of these things that I talk about. And that's part of the reason why I wanted to do these streams in the first place, is to try to kind of find a community, like online, like, how a lot of content creators, people come to watch their content because they talk about things they're interested in. And so that's part of the reason why I do this, is just so I can talk about the stuff with somebody, because it's kind of, a lot of it's off the wall shit. So I don't know. I can't reiterate it enough that if you've ever watched somebody die a slow, agonizing death, you would see why this, to me, is not wrong. Even active euthanasia of someone who has agreed to it. I'm not saying let's just kill people because, like, for fucking funsies, but, like, let's put out an example advance directive. Why, Cat? Let's say, for example, they add to your advanced directives, like you have do not resuscitate, full code, and maybe you could have a little box that says, like, the wording of it would be so important. I think that a lawyer would have to draw this up for each individual person and what their specific criteria would be. Something I was talking about earlier, and I lost the thread of what I was going into. With the power of attorney, and even with a DNR order, let's say that, well, let's use this as an example. My grandma's in a nursing home. I'm her power of attorney. She has an advance directive that says do not resuscitate. She gets to the point she can't make her own decisions anymore. Like, she has a heart attack and is unconscious dying. As the power of attorney, I can still verbally tell people, I changed my mind, do CPR on her. Even with that piece of paper with the doctor's signature, if your power of attorney does not agree with you, your piece of paper, you might as well use as toilet paper. Because your power of attorney can change anything they want that you have previously set, because they have the power. So if you, and by the you, I mean the proverbial you, anybody, pick someone you know agrees with your moral standpoint on, like, CPR and heroic measures. Because if you're of the mindset, well, I'll just pass away naturally, and they say, I want everything done to keep this person alive, you're going to end up on a fucking ventilator with a feeding tube, and you have nothing to say about it if you're unconscious or unable to verbalize your own wishes. Yes, they can, Lewis. And opposite. If you say, I want everything done to keep me alive, and your power of attorney says DNR, and you are unable to make your own decision, and the second you go unconscious, that kicks in. Once you, like, let's say you're having a heart attack, when you're unconscious from your heart attack that's killing you, your power of attorney can legally say, stop CPR, I don't want it done, or even to initiate it. The second you can't be the second you're not competent mentally or physically to make your own decisions, the power of attorney for medical power of attorney, I'm not talking conservatorship like with money, medical power of attorney can override you in any direction that they see fit. So it's very important, imperative, that you pick someone that agrees with you, because they're the ones that are holding your fucking stuff in their hands. I mean, so even if you have this legal paper signed by the doctor, signed by a lawyer, notarized, everything's perfect, it was written up by a lawyer, the second you're unconscious, that power of attorney kicks in. They can do the opposite of what you requested. And I have had that happen before. It was a wife, her husband was a DNR. He was having a heart attack. She said, please do something. And I said, do you want us to attempt CPR? Is that what you're asking for? And she says, yes. And we had to start it. He did not make it. DNR all the way. That's a struggle in our household. And because Eugene doesn't want, especially while I was pregnant, that was the biggest time. I have been a DNR since I was like 19 years old. But since we have a small child, he wants me to have them try a little harder to save my life, basically, like, just so that our son can have the knowledge that they tried to save his mom, if that makes sense. So for now, I'm okay with that. And did you know, Lewis, and here's another thing a lot of people don't know about the medical field, if you go to the hospital for surgery, a lot of the time the paperwork that you're signing has you rescind your DNR until you are out of the hospital. So let's see, what kind of surgery might you have? Let's say you had appendicitis. Yeah, I do too, and that's why I didn't fight that, even though it is something I feel strongly about too. But I see that point, and for my son, I'm willing to make that, at least for now, to make that an option. And like I said, I don't even have advanced directives, so Tony would make all my decisions anyway. Pull the plug. A lot of the time in fine print, when you're going into surgery, even if you have a pre-existing DNR, they put it in the fine print. Most surgeons will not operate on someone who's a DNR. And a lot of the time, and I heard this from a doctor who's done surgical procedures, she told me this. Because I was scared when I went to have my surgery, and I was like, oh, I'm a DNR. And she's like, not at that time you weren't. Unmarried with no kids. See, and that was, I didn't, even being married, I was like, well, this is still how it's going to be. I don't want all that stuff. But having a kid, I can see having the you know, your kid would want you to not give up or whatever, and as a small child. So when he's older, that's back to that. There's that too. There's that too. So you see what I mean? How these things are so multifaceted that it's not a decision to be taken lightly. There's so many different things that go into it. Would you want to live if you were paralyzed literally to where you could only type with your pupils of your eye? So your whole body, you can't move. You can't breathe on your own, move, do anything on your own, except for move your eyes to type on a computer screen. Of course, so you're going to get muscle contractions. You're, even with physical therapy, moving your arm, you're at some point you're going to contract. Your muscles will turn in like this. Your neck will extend like this, which means when you swallow, which is also affected, you can't swallow. You're swallowing liquid into your lungs, so you're going to have multiple cases of pneumonia. They're going to grind up your food into a puree. They're going to thicken your liquids, which taste fucking terrible. I've tasted them. We give them to our patients. You're not going to be able to consciously empty your bladder all the way, so that you will have UTIs. You'll probably have a Foley catheter, which is a tube that they're going to stick up your dick. I mean, I think some people can live a quality life that way. A lot of that boils down to money, unfortunately, and also what your expectations are. I wouldn't want that. Fuck no. No way. I want to eat my own food. I want to poop my own poops. I don't want my poops going in a bag. I don't want other people wiping my butt for me. I don't want to be in pain and all crippled up and can't breathe and choking on my own saliva. I don't fucking want that. That's gross. I don't judge other people if they want to live that way. That's their choice. And that's what all of this boils down to. As individuals, what choices do we have regarding our lives and deaths? I would want the option. I wouldn't even take it. I wouldn't, at this point, for me, because I'm not terminally ill. I'm in some pain, but not that much, just from chronic shit. But I want the option, god damn it. I think all of us should have it. And who are they to say that you can't? And a lot of the ways that people would commit suicide without doctor's assistance are not humane. I mean, you got, like, guns can misfire. They can blow part of your head off and now you're in a wheelchair. You can hang yourself and then you slowly choke to death and they save you after 5 minutes and now you're brain dead. Which I guess would effectively be dead, but now you're in a fucking wheelchair. Or you could take a bunch of medication and burn out your liver and now you're on dialysis, but you're still fucking alive, but worse off than you were before. I think having a medical professional assist you in that aspect would alleviate a lot of suffering. And I believe there should be stipulations. There should be psychiatric testing. There should be more physical examinations to make sure that what you're dying of is what they're actually dying of. And so all of that, I think, should go into it. So there should be criteria that needs to be met for physician's assistants. And the people talk about the Hippocratic Oath. Do no harm. I will not play at God. Blah, 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 blah. What's doing more harm? Allowing people to live that way? Or letting them die a peaceful death when they're ready on their time and alleviate and prevent some of that suffering? Is it more moral to, and I'm keeping religion completely off the table here. This hasn't, I mean, not even touching on that. Is it more wrong to help someone to end their life than to sit there and watch them suffer day after day after day, and their families have to watch them suffer day after day after day? And in hospice, the families, treating the families, and like, we're not treating them medically, but we're treating them supportively. We're telling them what's normal. We're telling them that, there's a lot of like, but they have to ultimately sit there and watch their family member die. And if they're doing it in their home, they're the ones who are cleaning up their poops, and they're the ones who are feeding them, and they're the ones who are administering medications. They're the ones that are doing everything. They're turning them. They're watching them drown in their own spit, gasping for breath. And a lot of the time, the patients die at night when the nurse isn't, like, the patient's not like, well, the hospice nurse is going to be here in an hour. I'll just wait for her to die. No, they don't. They die at home. Yeah, pretty much. I mean, people talk about playing God when it comes to ending someone else's life, but we're doing that when we artificially extend someone's life as well. Thank you so much. Because I hear that all the time. Well, we have to do what's in God's plan. We have to let this person die a natural death. Okay, listen, bitch. If you were letting them die a natural death, you wouldn't have them hooked up to all these goddamn machines. They'd be dead already. So let's not talk about playing God. I don't mean you, Lewis. I mean, like, yeah, that's, and then, but when you say that, their argument for that is, well, God gave us the knowledge to invent those machines. Get the fuck out. I have no tolerance for that bullshit. At all. It's not, I don't think it's playing God. As you just pointed out, that's, I mean, but then again, if they're using that argument of, well, God allowed us to invent these machines, well, God allowed somebody to invent that Thanatron too, and how well did that work out? Oh my God, Lewis, I never even went there. You hit the nail right on the head with that. We don't like death because it's uncomfortable. We don't like losing a loved one because we feel the pain. We feel the pain of, if your mom dies, that hurts you. It's not hurting her anymore. It hurts you. And whether it's, grief, or a lot of the time people will feel guilty because they didn't do every single fucking thing possible to keep them alive. There's guilt. Well, I let my mom die. Yes, you did. And that's not necessarily a bad thing. Just because keeping people alive isn't necessarily the goal. It is very selfish in some situations. In some situations, like, maybe they really medically don't need to end their life with the help of a physician. I mean, anybody has the right to, like, fucking kill themselves at any time, and they could. I'm talking about, like, with medical assistance. But yeah, it's and a lot of that has to do with our culture, the way we were raised. Dying people, they, more often than not, even hospice patients will start off at their home, but once they get near to the point of dying, that's when they move to the hospice house, which is okay because it's around the clock care, excellent care. Well, I can't speak for everyone, but around the clock care, and so there's always somebody who's right at the beck and call of giving medication, and they're, you know, treating every symptom as it comes up. But I don't know, I think a lot of people get guilt. There's a lot of it's and guilt. Oh my god, I'm not gonna Kubler-Ross on Death and Dying, 5 stages of grieving. You know, you have your denial, bargaining, anger, depression, acceptance. Anybody, yeah, that's a whole nother thing for a whole nother day. But yeah, the denial part, and those stages of grieving begin before the person even passes away. So a lot of the time with the denial phase, it's, well, maybe they'll come up with a miracle cure while we're waiting. And how many times does that happen? Like, when did that work out for you? So I've been going for over 2 hours on my fucking soapbox here, and I knew this was going to happen. I should have warned everybody. You know, like, it's a very personal subject to me. I can't, there was no way to talk about this topic without going off on all these crazy tangents. And maybe I digressed a little much, but in a nutshell, I think that Jack Kevorkian was a fucking weird dude. He didn't always do everything perfectly, but he had the fucking passion and the conviction to want to do what was right, whether it was legal or not. And he wanted to, his ultimate goal was to relieve the suffering of dying patients. And I think he fucking did it. And I think he's a hero of mine. It's an emotional subject. It really is. And I think it's almost easier for me to talk about this kind of stuff than it is for, like, just to report on, like, Jeffrey Dahmer, which I'm sure he's coming at some point in the future. But there's a lot more thoughts that are in my head about this specific subject. A lot, and because there's so much controversy, it's like, well, what about this? What about this? What about that? You know, like, do I feel this way about this? How do other people feel? I asked other nurses in the last couple of days when I was listening to these podcasts on my downtime at work what they thought about Jack Kevorkian and Right to Die. And they were very, very distinctively polarized. And it was also not a true representation, because there might have been some, like, I don't want to say racial bias, but here's what I mean by that. A lot of the people that I work with are from Africa. And when I asked the other nurses that what their opinion on it was, they were very polarized. And it does kind of go hand in hand. I don't know about correlation and causation and all that, but they were either very strongly for it in the same way that I am, or they were strongly against it. Now, the ones that were strongly against it, and this is a very, very small subject group, so this isn't like scientific or anything. They were very strongly religious and also from Africa. And I don't know what their culture is like that's different from here, as far as, because they were strongly against it. They say, well, that's murder. You can't kill people. You have to let God do it. God, God. And then the other nurses were all, not all, a couple of them were from, one of them was from, oh, goodness sakes, what place is that from? I can't think of where she's from. She almost looks Asian, but not quite. I'm drawing a total blank on where she's from, somewhere else. Let me put it that way. And Philippines. She's from the Philippines. And then, let's see, who else? And one of them was a man, an American man. And then a couple of, like, just basic white bitches like me. And so all of those said they were strongly for it. So I don't know if it's a religious or a cultural or both. But like I said, they're either strongly for it or strongly against it. And most of the people that were strongly for it were not overtly religious either. Like, they weren't, maybe they were Christians and they go to church or whatever, but they're not like having hour-long prayer sessions in the hallway in the middle of the night when they're supposed to be doing rounds. So I tried to specifically not bring religion into the mix because that would bring a whole different aspect into the debate, and I didn't want to go there today. So it's more of like it is a moral and ethical problem, controversy, whatever you want to say. But if you take the religious, a lot of people say, well, you can't kill people because God said so. If you take that out of it, I think I'd like to end tonight on a quote, and I may misquote it. I say that every time because I'm bad about that. From it was a thing that Penn and Teller did, and I get them confused. I can't remember which one's which. He said, "Well, people ask you if you're not religious and believe in heaven and hell, what stops you from murdering and raping and pillaging all that you want to?" And he says, "I do murder and rape and pillage as much as I want to. And that's zero. I don't need God to tell me what's good and bad. You don't need the threat of punishment to tell you what is right and wrong. So if you are acting out of a fear of punishment or a look to a reward for acting a certain way, that seems disingenuous to me. You're not stealing and robbing and raping just because you're going to get punished for doing so or rewarded for not doing so. What about right and wrong? A whole cultural thing, religion is generations and generations ingrained in a certain part of society. No, you're not explaining this poorly. That's what I mean. That's what I'm talking about. And so, like I said, my subjects that I was interviewing it was a very small group. Like basically the night shift over 3 or 4 days. And so Penn. Okay, yeah, well that's what I'm saying is like I never was sure which fellow was named which. So I can tell them apart obviously, but I could the names never stuck as to who was who or whom was who. I also don't know the difference between who and whom. Don't tell anyone. All right, so I'll let you guys get off of here. That's again, you've heard my points of view on religion, and it is what it is. I mean, I like the thought of it. I think that there are good morals that can be learned from it, but the corruption is, yeah. Let's not go there tonight. All right, everybody, I'm gonna end it. So everybody have a good night. Thanks for coming. I don't know when my next planned stream will be. I think this Saturday coming up, I think I will do one. I'm actually gonna create my own Discord. I haven't done it yet, so when I do, I will send invites to everybody. So, and I'm sure Eugene will have some sort of Discord. I mean, he's not just gonna like fuck off of Discord forever. I know it. So, all right, everybody. Kitty, say goodbye. Goodbye, everybody. Have a good night, and I will talk to you soon. Planning for Saturday. You know how it is with me, man. Sometimes my shit doesn't work. Sometimes I fall asleep. So, hope to see you on Saturday. I think we're still gonna talk about the Alaskan Avenger. And there was somebody else. I had another one. So far we'll just plan on the Alaskan Avenger, Jason Vukovich. And gonna take it from there. Alright. Have a good one, everybody. Bye. End.